I'm John Murray. I'm the Executive Director of Service Delivery for We Are With You in the north of England. I previously served 13 years in the Royal Air Force Regiment before I came to the organisation. Our response to COVID-19 has been, even though I do say it myself, really impressive, because we moved to a virtual model overnight in order to support our veterans and service users. And what I mean by that is we have static service-based locations across England and Scotland. And because of the threat that was posed by the virus and the pandemic, we needed to protect our veterans and service users as much as possible. And also our workforce. What we've seen over the past few weeks and months is that we've been able to really support our veterans when they need it the most and where they need it the most, and by giving them online tools in order to speak to us over video conference. And we've had a really good uptake from our veterans, and it gives me an immense sense of pride and satisfaction that we've been able to provide them that level of support.
Hi, my name is Lee Flowers. I'm the project coordinator for the Right Turn project, which supports the Armed Forces community for the organisation. I was in the Air Force. I was an airframe and bolting technician, and also the mountain rescue team. Everything lost. The skills that experience gave me have been really transferable into my current role and to this organisation, and benefited both. Some of the most important parts about that are being flexible and adaptable in terms of roles. I've had 3 roles since I joined the organisation, and been able to drop into teams seamlessly and be productive in those teams. I've also been able to adapt well to teamwork as well, which I got from the Air Force. And as we moved around the organisation, I've been able to use the resilience I've built from my military experience to maintain my discipline, work under my own steam, and build relationships with not just teammates and colleagues, but with other agencies to support the Armed Forces community for the project.
Gary Besterfield, currently the service manager for We Are With You. Previous to this, I was in the Coldstream Guards, serving 5 years as a guardsman. And transferable skills are taken from that. Ultimately, I think it was teamwork and team spirit, ability, almost a can-do attitude, and no job's too small or too big, and to work as a team, and really to thrive on bringing the weakest member in with the team, because you go at it together, and really a can-do attitude and overall strong work ethic. And again, just attacking anything that comes your way and supporting everyone that comes through that as well.
Hi, my name is Paul Hughes. I'm the Executive Medical Director for We Are With You. I served 31 years in the Royal Navy and enjoyed jobs such as commanding the Defence Medical Rehabilitation Centre at Headley Court, and latterly as the Commander of Defence Primary Healthcare, delivering primary healthcare to all 3 services in the UK and overseas. In terms of responding to COVID, I think we've done very well. As John has said previously, we responded very quickly to delivering a virtual service. We were working at the national level with Public Health England as one of the lead providers in determining how best to safely deliver both alcohol and opiate substitution treatment, to our clients in this very difficult period. We've had to change the way that we have worked with our pharmacies to reduce the load on them and also give greater autonomy to our veterans and service users accessing our services. We are very proud to be looking after our veterans for our Right Turn programme, and we look forward to providing that support for many years to come.